Chikungunya virus outbreak. Global health alert by WHO. A global chikungunya epidemic looms, warns WHO. Urgent action needed to prevent history repeating itself. The World Health Organization has issued a stark warning. The globe faces the imminent risk of a major chikungunya virus epidemic. With 5.6 billion people at risk across 119 countries, urgent action is needed to prevent a repeat of a devastating outbreak that swept the Indian Ocean 2 decades ago. Chikungunya is a mosquito-borne viral disease that causes fever and severe, often debilitating joint pain. In some cases, it can even be deadly. The WHO's Diana Rojas Alvarez highlighted that the organization is seeing the same early warning signs as in the 2004 to 2005 outbreak, which affected nearly 500,000 people. From the beginning of 2025, major chikungunya outbreaks have been reported in Réunion, Mayotte, and Mauritius. Alarmingly, 1/3 of Réunion's population is estimated to have already been infected. The virus is now spreading to other places in the region, such as Madagascar, Somalia, and Kenya, with epidemic transmission also occurring in South Asia. In Europe, imported cases linked to the Indian Ocean Islands outbreak have been reported, with local transmission in France and suspected cases in Italy. The WHO is calling for urgent action to prevent history from repeating itself, as the case fatality rate, though less than 1%, could translate to thousands of deaths when millions of cases are involved. The organization aims to raise the alarm early so countries can prepare, detect, and strengthen capacities to avoid large-scale outbreaks. In regions with little or no immunity, the virus can quickly cause significant epidemics, affecting up to 3/4 of the population. Chikungunya is transmitted to humans by the bites of infected female Aedes aegypti and Aedes albopictus mosquitoes, with the latter, known as the tiger mosquito, venturing further north, marking further due to climate change. The WHO urges people to protect themselves using mosquito repellent, and by not leaving water to stagnate in containers where mosquitoes can breed. But here's where it gets controversial. Is the world doing enough to combat the spread of mosquito-borne diseases in the face of climate change? And this is the part most people miss. The WHO's warning is not just about chikungunya, but about our global readiness to handle emerging health threats. What do you think? Are we prepared for the next pandemic? Taiwan raises travel alerts for Brazil and Réunion amid Chikungunya crisis. In a significant move, Taiwan has heightened its travel advisory for Brazil and the French overseas territory of Réunion Island to level 2, urging travelers to be more vigilant as the Chikungunya outbreak intensifies globally. This decision comes from Taiwan's Centers for Disease Control, CDC, which issued a press release on July 23rd highlighting the growing concerns surrounding this mosquito-borne virus. But here's where it gets controversial. While many may think of chikungunya as just another tropical disease, the reality is that it has been spreading rapidly, with over 250,000 cases reported worldwide this year alone. The World Health Organization, WHO, has responded by calling for urgent action, encouraging nations to implement preventive measures to combat this alarming trend. The CDC's report indicates that the Americas are currently facing the most severe outbreaks, particularly in Brazil, Bolivia, and Argentina, where the number of cases has surged. Additionally, the chikungunya virus has made its way from the Indian Ocean islands of Réunion, Mayotte, and Mauritius to other regions, further complicating the situation. According to an AFP report, it is estimated that around 1/3 of Réunion's population has already been infected. A staggering figure that underscores the virus's reach. In Asia, India has also seen a significant rise in cases, with over 30,000 reported this year. In Guangdong province, China, a local outbreak has led to more than 2,600 cases, primarily linked to imported infections. Macau also reported similar imported cases, prompting several Chinese provinces and cities to issue public health advisories in response to the threat. In Europe, the situation is equally concerning. France has documented 30 local cases and 799 imported cases this year, while Italy has reported 1 local case. Interestingly, this year's outbreak in Europe began unusual early in June, contrasting with previous years when cases typically peaked between July and August. In light of this global health crisis, the CDC has ramped up health screenings and fever checks at international ports.
They are also conducting TOCC evaluations, travel, occupation, contact, and cluster history, testing, providing health education, and distributing mosquito repellent to travelers arriving from affected areas who show symptoms or are considered at risk. As of July 22nd, Taiwan has recorded 15 imported chikungunya cases, marking the highest number for this period in 6 years. Notably, 13 of these cases were linked to travel from Indonesia, while the Philippines and Sri Lanka each contributed 1 case. This is a stark contrast to the number of imported cases reported from 2020 to 2024, which ranged from 0 to 5 during the same time frame. The chikungunya virus is primarily transmitted to humans through the bites of infected Aedes mosquitoes, specifically Aedes aegypti and Aedes albopictus. Symptoms of the virus can include fever, joint pain, headaches, muscle pain, joint swelling, and rashes, making it a serious concern for public health. What do you think about the current response to the chikungunya outbreak? Are the measures being taken sufficient, or do you believe more aggressive actions are necessary? Share your thoughts in the comments.
Global health alerts, chikungunya spread, Mpox in Gambia and H5N1 in cows. In a world where health crises can escalate rapidly, the World Health Organization, WHO, has issued a stark warning regarding the chikungunya virus, emphasizing the urgent need for proactive measures to avert a potential global outbreak. During a recent briefing in Geneva, Dr. Diana Rojas Alvarez, a medical officer with the WHO's arbovirus team, highlighted alarming similarities between the current situation and the significant chikungunya epidemic that occurred 2 decades ago, which devastated several countries around the Indian Ocean. This year, areas such as Réunion, Mayo, and Mauritius have become hotspots for the disease, which is transmitted by mosquitoes and has now spread to Madagascar, Somalia, and Kenya. Furthermore, outbreaks are being reported in South Asian nations, and there are indications of local transmission in mainland France and possibly Italy. In another significant health development, the Gambia has confirmed its first case of Mpox, a viral infection previously known as monkeypox, following routine surveillance efforts. This announcement, made by the country's health ministry, marks Gambia as the latest West African nation to report Mpox, bringing the total number of African countries with reported cases this year to 25. The Gambia, a narrow strip of land almost entirely surrounded by Senegal, is now facing a nationwide response to this emerging health threat. Additionally, the U.S. Department of Agriculture, USDA, has reported 2 new cases of H5N1 avian influenza in dairy cows from California, raising the total number of confirmed cases to the U.S. to 1,777 across 17 states since early 2024. California remains the most affected state, with 770 cases recorded. In a separate yet equally important announcement, the U.S. Department of Health and Human Services, HHS, has accepted the Advisory Committee on Immunization Practices, ACIP, recommendation to eliminate thimerosal, a mercury-based preservative, from flu vaccines in the United States. This decision comes after a lengthy period of deliberation and is aimed at safeguarding vulnerable populations, including children and pregnant women, from unnecessary mercury exposure. HHS Secretary Robert F. Kennedy Jr. emphasized the importance of this move, stating that it is a step towards prioritizing public health and safety. Despite thimerosal's long history of safe use since the 1930s, it has faced scrutiny from vaccine skeptics who associate it with rising autism rates and mercury poisoning in children. However, extensive research, including over 40 studies, has consistently shown that thimerosal poses no significant risk, with only minor reactions reported at injection sites. Lastly, a recent study conducted by researchers at the University of Michigan has shed light on the concerning trend of inappropriate prescribing practices in urgent care settings. This study, published in the Annals of Internal Medicine, analyzed data from over 22.4 million urgent care visits between January 2018 and December 2022. The findings revealed that a notable percentage of patients received unnecessary prescriptions for antibiotics, opioids, and glucocorticoids. Specifically, 12.1% of visits resulted in antibiotic prescriptions, 9.1% for glucocorticoids, and 1.3% for opioids. Alarmingly, many of these prescriptions were deemed inappropriate based on established medical guidelines,
For instance, while antibiotics are appropriate for 58.2% of upper respiratory infections, they were frequently prescribed for conditions where they were not warranted. The authors of the study advocate for a multifaceted approach to address these prescribing issues, emphasizing the need for better clinician education, patient awareness, and decision support systems in urgent care environments. As Dr. Shirley Cohen-Meckelberg, a co-author of the study, stated, reducing inappropriate prescribing of antibiotics, glucocorticoids, and opioids will require a multifaceted approach. This highlights the ongoing challenge in ensuring that patients receive the most appropriate care while minimizing the risks associated with unnecessary medications.